Hi, welcome back. I'm Dr. Jenn Kennedy with The Pleasure Project. So today's topic is number 2 in the series of what creates low desire, and that is psychological stuff. So there's all kinds of things that come into play for this one. I think about like when people come in for sex therapy and stuff that presents consistently with psychological, that could be grief, right? If you're recovering from the loss of someone or even a pet, like you're in a grief state and you might not feel terribly interested or desirous, that makes sense. So sometimes we have to give it a pause and let that play out and let that heal before you might be able to return to that realm. So another example of psychological would be depression or anxiety. Everybody's anxious right now. It feels like anxiety is off the charts. Well, anxiety definitely interferes with desire because in the stacking of needs, safety comes way before desire and pleasure do. So we have to address issues of safety. We have to address issues of fear or avoidance or worry. Like if you're preoccupied, it's going to be hard to tap into that piece. So if you're anxious or if you're depressed, and depression kind of sneaks in. Sometimes it's situational and sometimes it's more organic and long-standing. But those conditions, those psychological conditions definitely may interfere with your desire for sex and partner relationships. That makes sense. So what I will say is that the things that help the most with both depression and anxiety, 2 things. Number 1 is a practice of mindfulness. Now, I know you're like, what's that mean? Well, it's kind of everywhere in the ether, but it really, really works. It's a practice of body-based dropping in, of feeling more connected to your breath, of quieting your mind. It helps with self-regulation. It also helps with your nervous system. So I love using the app Headspace. I give that to clients quite a bit. There's a couple other ones that are great out there, but mindfulness on a regular basis really, really does help. Number 2, to help with anxiety and depression, is exercise. So moving your body, getting some blood flow just helps. It does. Psychologically, it really makes a difference. So if you're finding that your low desire is probably related to those things, then I would say those are your first 2 lines of getting at it, of starting to help move it a little bit. Now, another big cause, psychologically related cause of low desire is self-judgment. And that can look like just intense criticism. Maybe that came from your family of origin and now you're doing it to yourself. Maybe it's around body, like you're so frustrated with your weight or with your size or your shape or whatever, and that makes you feel super self-conscious and so less inclined. That would make sense, again, that your desire would be like you might feel a lot of ambivalence about engaging in sexual play because it means your body is being seen, it means your body is being touched, and that can sometimes feel really hard. And so if that's interfering with where you're at with your own relationship to self, then likely it's going to translate just into this kind of fog of low desire. Like, nope, I don't want it. I'm going to avoid it. So that's part of what we cover in the Pleasure Project, is understanding where is this coming from? What are the messages that your whole environment is giving you, your history, your family of origin, but also now yourself, because typically this stuff originally came from somewhere else, but now it's you that's giving yourself that message. And so it might be really subtle, but it's easier to just opt out and not have sex because you don't want to have to deal with all of that. So if you're critical with your body, if you're kind of in this internal battle, then it kind of might make some sense that you might also feel avoidant to intimacy, vulnerability, nakedness, right? So think about what gets in the way when you sort of get signals of sexually relevant. So that might be your partner initiating. What happens for you? Do you go, ugh, I feel gross, or I'm not pretty enough, or I don't want you to see me, or whatever. If it's in that realm, if it's self-judgment, if it's body image, that type of thing, then I think it's really worth considering kind of what are the messages that you're giving yourself. Now, another piece that comes into play around the psychological that creates low desire is trauma. Trauma is a big one. And that can look like big trauma, little trauma. Big trauma would be like an assault. If you have an assault in your history, if you have a history of sexual abuse, that type of thing, likely sex is a very loaded topic for you. You might not feel safe. You might suddenly have a sense of powerlessness when you're in that dynamic. So that probably warrants some psychotherapy. That might mean that you need to help unpack that or process it. I love EMDR. I think it is such a powerful and efficient protocol for working on trauma. And that helps with the big traumas as well as the little traumas. The little T traumas, as we call them, is more like, say your first sexual experience was embarrassing. Like you felt awkward and you felt fumbly and it didn't work out very well. Or say your mom walked in on you having sex with your partner, right? That's like mortifying and could be kind of traumatizing in a way, depending on how it all played out. So little T traumas come in different forms, but they definitely have a residual effect. They stay with us. So thinking back to, what are your associations? Do you feel shame? Do you feel fear? Do you feel, what comes up for you around that? Because that is going to make a difference. And psychologically is a huge piece of why people, women in particular, feel low desire. It's not just like, I just don't want it. No, you don't want it because there's been something that has sort of made you averse to it. So if we can start to unpack, that's going to help. The last thing, which sort of leads us into the next video, is low relationship satisfaction. So that's going to look like maybe you have resentment because maybe there's been infidelity, or maybe there's a power indifference, that type of thing. So if the relationship isn't doing well, then you might not feel close to your partner. You might not want to feel close to your partner. So psychologically, you're guarded, you're avoidant. That makes sense. So again, psychotherapy might help, doing some of that, talking about it, which is part of talking to your friends or talking to your therapist or talking to, whoever is in your support system can help. Within the Pleasure Project, and specifically the small group that I run, the Pleasure Circle, we unpack these things separately and go, okay, what is it? Now, we're not going to we're not doing deep processing of all this. That's more for therapy, but at least naming it, understanding it, and then having some way to start to process it. So I really encourage you to kind of look at what psychologically is at play and what messages are you giving yourself, because likely that is a big factor into your low desire. So stay tuned for the third video in the series, which will be coming shortly. And that is all about the interpersonal elements that create low desire.